details.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Not to be poor and start trying to get rich.
Are you a debt collector?
By relieving people with the burden of debt.
Are you trying to go back to prison?
We have information that your client may have tucked away a very large sum of money.
Guys like you don't misplace $10 million.
We made a promise. Someday we was gonna make it big.
This is Rogers TV, Gray County.
Thank you and welcome for joining us today on this special edition of Rogers TV COVID-19 dedicated to our community responses regarding this pandemic. My name is Carol Merton, and first, before I actually introduce our guests today, I want to take just a moment to extend a most sincere and heartfelt thank you to our Medical Officer of Health, our Public Health Unit staff, our community service providers and support agencies, our first responders, our hospitals, retirement homes, long-term care facilities, our essential frontline staff in grocery stores, pharmacies, our delivery truck drivers, our gas station attendants, and so many others as well for their prompt action and their continuing efforts to keep our community safe. We are all together in this exceptional and ever-changing situation. We are all neighbors doing our very best to take care of each other and to support each other. Here at Rogers TV, we will be providing you with current information from our community agencies and our elected officials. However, as you probably are already aware, this information does change rapidly. We encourage you to stay current with the situation by going online to the Public Health Unit website at publichealthgraybruce.on.ca, listen to the radio, read the newspaper, and of course, tune into Rogers TV for updated information. Today, I'm delighted to welcome to the program two guests. They are husband and wife, and so they are sitting close together because they're at home and they are socially distancing, but together in their home environment. So today, I'm delighted to welcome Ansul and Mageesh. They are both physiotherapists who are practicing in our community, and I want to welcome both of you to the program. Thank you for being here today.
Thank you, Carol.
Thank you, Carol.
So, this is an open forum where whoever wants to answer and discuss, please do so. But, I first of all, I was wondering if you could tell us a little bit about yourselves, how long you've been working in the Grey Bruce area. And I understand you have just opened up a new clinic. So I wonder if you could share about that clinic too. So I'm turning it over to you.
Thank you, Carol. Yes, my name is Mageesh, and I am a physiotherapist. We moved to Owen Sound in 2014, so well over 5 years now. And yes, we did open our own business. It's Physio Care Owen Sound. It's in the west end of Owen Sound in the plaza that has the M&M Meats, the Little Caesars Plaza, the All Things Tea, and the IDA Pharmacy. I started off as working in the community as a physiotherapist, and then on I also worked in a couple of clinics in Owen Sound and Meaford. And we decided to come up with our own clinic, and we were all set to open the last week of March, and then came COVID.
Oh no! Oh, not good.
In many ways, we are still open virtually, And that is what our talk is also going to be on telehealth, and we're going to be talking more about it. Anshul?
Yeah, I'm Anshul. I am his wife, but I'm also a physiotherapist and his partner in the clinic. We have been in Owen Sound since 2014, so 6 years around, and I have been working in the community outpatient clinic, the OHIP clinic, and then last year I quit that, and we decided that we're going to go on our own. I also work in the hospital just a little bit, and I also work in long-term care centers, and we had decided to open our clinics because we really are so into our work and wanted to kind of do things a little bit differently from what we were doing before and give everything of ours into our patients' care. So, yeah.
Wonderful. I can't help but think how unfortunate it is that you were just on the beginning of opening your clinic. But on the other hand, it's opened up other opportunities for providing care that perhaps may not have come directly to mind. So we're going to be talking about telehealth or telerehabilitation. I've heard it expressed in both terms. So I'm wondering if you can tell me a little bit more about what that means and walk me through it as if I was a patient. So if you can...
Just before we go into that, I must say this. Yes, we did not open our clinic physically, but we did put a Facebook post about our predicament, and the response from the community was amazing. We live in a great place, and the response that we got from people, the sympathies and the wishes and the support as such was just amazing. So we are very confident that we are going to come out of this much more stronger than what we went in.
Excellent.
Yes. Talking about telehealth is basically providing physiotherapy care remotely. So here we would be using a video platform or a telephone conversation in which we would be consulting the people who need physiotherapy services. There was a time when this was still very much used. The College of Physiotherapy recommended telehealth for people who could not otherwise access a physiotherapist in a physical clinic. But now, considering all the COVID restrictions that we have, it is widely practiced and many physiotherapists are using that in their practice. We basically want to be there for the people when they need us. And this provides us a fantastic platform for people to connect with us remotely, like I said, either via a video conferencing platform or in some cases even via a telephone. Do you have anything more to add, Anshul?
No, that's pretty much it. It's virtual, but it's the need of the hour. We need it right now. So yes.
So today we're having this interview by Skype. Is Skype something you would use, or do you use what platform would you use?
So what we use is called a Jane app platform. It is the same platform which we have been using for last year or more for scheduling and charting. So it is a safe platform. It is compliant by the privacy regulations. Unlike Zoom or Skype or FaceTime, this particular platform that we use it does not allow anybody other than the patient and the therapist to access any of the information, including the video chat or the paperwork or anything. So it is closed on the other end, which is what is required as per legislation and rules to use whenever it comes to telehealth, to have a secure platform. So that's what we will be using, a secure platform.
So you mentioned the legislation, and we hear a lot about personal health information, and so it sounds as if by using this platform, you're doing everything you can to make sure it's secured, and I think that's important. So if I was a patient, do I have to have Jane app on my system as well to be able to have this conversation?
So I may want to answer that. Jane app is one of the platforms that we use. There are other platforms that other providers use as well. And we as physiotherapists are required to have a secure platform. So rest assured, if you are having a telehealth conversation with your physiotherapist, you can be rest assured that they are using a secure platform. And when it comes to Jane app, yes, we will send in a link. When like the first thing is you would give us a telephone call, or you may want to send us an email, and during that conversation we will determine if telehealth is something that will be appropriate for you. I must also say that if there is a need for an in-person physiotherapy appointment, we do offer them, and there are physiotherapists in the community that offer that as well. And this is something that we will determine when we have that conversation prior to the appointment. So once we have decided that yes, telehealth is something that's going to be useful for you, we would be sending you the link from which you can easily log in. And from then on, it's just like having a Skype conversation or a FaceTime or anything, only it is going to be safe and secure so that we keep your privacy and confidentiality.
Yeah. And getting back to your answer, Carol, you don't need to download an app. As long as you have a laptop or a tablet or an iPad and you have a speaker system two-way, like hearing and speaking, and if you have a webcam, all you have to do is click the link that we sent you on your email, and it just gets you right through.
Yes.
So you don't need to download a special app, not necessary.
So you would just send me an invitation and I would just simply link on that, right?
Absolutely.
Yes.
That's how simple it's supposed to be.
Yeah. That I like simple. I have to be honest, especially when it comes to technology. So what sorts of patients would you normally talk to and treat by telehealth? Can you give some examples of patients that you would think would qualify as appropriate for it, and others that you think would really, really need that physiotherapist hands-on?
Excellent question. The first thing is, if you required physiotherapy and you went into a clinic, your typical neck pain, your back pain, your shoulder injuries, yes, you will definitely benefit with telehealth as well. Although I must mention that we are going to miss the in-person experience. That valuable hands-on skills that we can deliver in a physical clinic, we are going to miss it. However, there are still other components, the education, knowing what is happening. For example, let us suppose you have this tingling in your hand and you're not quite sure why your hand is tingling. And that is where we come in. We would be able to do our movement tests and our assessments, and based on your mechanism of injury, and there are certain tests that we will modify. And if there are any members in your home that can help you, we would be able to make best use of that as well. And performing our tests, we would be able to diagnose what is going on, and we will be able to educate you on why you're having this pain and what we are going to do about it. Our treatments are going to be educating you first on what's happening, teaching you some exercises and treatment methods, some self-mobilization techniques, some simple strategies that you can do on your own that is going to address this pain from worsening any further. You know, like Ansul says, there are two components. One is you do nothing and it gets worse. And the second thing is you do something wrong and it gets worse. That is where we come in, and we would be able to guide you through that process so that we would be able to help you get better and feel better. Do you have anything more to add, Ansul?
Coming back to specific situations, you're raking your yard because you think the weather is good, and you feel like you overworked your shoulder. Next morning you get up, you can't lift your shoulder. You're wondering if it is like you have really broken something versus if it is just a little overuse. You don't want to go to ER because you don't want to be the person clogging ER, or you're worried about the community acquired infection. That is a good idea. You can call up and talk to a physiotherapist and determine if, you should actually be going to ER or you should see a physiotherapist. Same thing goes with your knee pain getting worse, or if your back is hurting more and, you're working from home and you've been sitting on a makeshift kind of an office desk, and your back starts to hurt and you're like, I really need to know if this is something that I should change, or what should I do? I know that this is not dangerous, but I need to know the right exercises. I don't want to do the exercises from Google and make myself worse. So that's another time when you can access telehealth. Another time is when you have a problem that you want to address, but you never had time, and you have a little time right now, and you do want to talk to a physiotherapist. For example, incontinence. A lot of women with incontinence, they're busy. They don't have the time to be able to spend on an hour-long appointment. The truth is that you can address a lot of those issues by talking to a physiotherapist and book a telehealth appointment right now, because
we have time.
Yes, we do have time, right?
There is, I guess, a little bit of a silver lining to the fact that we have to stay home, like we're just supposed to be staying put. So for sure. What do you say if people say, well, is it really as good a quality care as I would get in the clinic? How would you answer that?
Yeah, so I can go for that. The first and foremost thing is we as physiotherapists are expected to deliver the same quality of care that we would otherwise provide in a physiotherapy clinic. But we do understand that, as I mentioned before, the valuable hands-on skills, the valuable hands-on thing, that in-person experience, we are going to miss it. But we want to assure you that this is going to be of the same quality, except for this one little bit of hands-on component that is missing. And yes, you can definitely expect, not only from us, but from other physiotherapists as well, we are expected to provide the same quality of care, and you will get it.
And adding on to that, the one thing which is, while hands-on is missing, one thing that is there is that one-on-one direct time. There is no distraction. There is no, somebody else waiting for you, and so you have to rush and so on and so forth. There's no waiting for rides. There's no calculating the transit time, the commute time from your home to the clinic. Those things definitely are better in telehealth, and I have noticed that the time I spent in interviewing my patient before I diagnosed them, it was very non-distracted and one-on-one, and it was definitely very quality time.
And I must agree with that. There is an absolute positive that comes from telehealth, in sense like this time that you spend with your therapist is going to be totally one-on-one. There is going to be no distraction. So you actually get more value in a telehealth appointment on that prerogative, for sure.
Mm-hmm. Now, is this paid for? I mean, your clinic is going to be a private funded clinic, and telehealth that you offer is privately funded. Is all of it privately funded? And if so, how do people do they get reimbursed? Does the insurance company pay?
So I must say that most of the extended health insurance companies have come on board. They are paying for telehealth appointments. Although I must still say it's best that you give a call to your insurance provider to make sure that they would indeed cover. But to the best of our knowledge, most of the insurance companies are on board, and they will cover your telehealth physiotherapy appointments. When it comes to the time that we spend and the professional value that we give, it is the same as we would otherwise provide in an inpatient physio setup. So the fee would pretty much be the same. But as I said, extended health insurance companies definitely cover. You may want to check in with your therapist if they offer direct billing, or if this is something you want to pay at first and then reimburse. Those are the same things that we would anyways do in a physical clinic back then.
Mm-hmm. So because let's say I was a patient, I'm not coming into the clinic, I'm having the telehealth. How do I pay? How do I pay you? What's the process? Because you're not physically there.
So how do you pay? Yeah, right. So the platform we use, it has a secure online transfer system, and it is just like how you pay for your online shopping on Amazon. So it's just as simple as that. You just put in your credit card details. Again, it's encrypted, so it is safe. Exactly how you pay for Amazon.
And I would get an invoice back that...
We will email you the invoice, and if there are certain exceptional circumstances where you're not able to pay online, you may want to discuss with your physiotherapist to arrange alternate payments. We are a small community. You could always drop in some other time, or we can always arrange other methods of receiving payment or paying. That is something you may want to discuss with your physiotherapist. But as Ansul said, yes, receiving telehealth and paying for it is as simple as shopping on Amazon.
So you've sent me some questions or some information. Thank you. I did get it. So I'm flipping papers here. But one of the things I read, which was really interesting, is how you can do things. It sounds like there's so many ways of providing physiotherapy care. And one was around taping, kinesiotaping. And can you talk a little bit about how you would do that when they're not actually in the clinic to be taught this?
So we have been doing it for some of our patients. We do allow them to buy a tape on their own. We also can give them the tape if they are within Owen Sound. They can come and pick it from, like, a curbside pickup. What we are doing is we for that particular patient and the type of taping that person needs, we are playing model and patient and therapist, and we are doing a video, and we are sending the video or pictures to the patients for them with instructions as in how to do it for them, because we have, it depends on the patient what kind of taping technique is needed for. It'll be different between Carol and Mageesh, so we will put it according to what the condition is, and then we can send it over, and the people can see the video or pictures and do it exactly. So it's not rocket science. I'm sure that it's easy to do.
At least to those that we taught, they found it easy.
They found it easy, yes.
Yeah. So, which is great, because then if taping techniques are a treatment, you're demonstrated, it's specific to the patient, and they've got it to refer to. It's not just a one-time show and tell. They can pull this video back up again if they need to. How long would I expect if I was to have a telehealth appointment? What timing? You had mentioned an hour. Is every session an hour, or how does it work?
So the initial appointment would last anywhere between 45 minutes to 1 hour. And the subsequent follow-ups can be 30 minutes or 45-minute appointments, in some cases even 15-minute appointments. A lot depends on what your underlying problem is and what we are going to do about it. So that is the discussion that we would be having during our initial appointment. So one thing that is going to be concrete is, yes, for us, the initial appointment is anywhere between 45 minutes to an hour, and the subsequent follow-up minutes would be typically 30 minutes. And just going back to the previous question, Carol, there may be some people who may need a splint. They may need something beyond kinesiotaping. And so again, this is something we can have it either shipped directly to their home. Some of the vendors who provide us supplies have offered to directly ship to the people's home. Or like as Ansul said, if they live nearby, they can always do a curbside pickup as well.
Yeah. A lot of the physiotherapy techniques for patients include exercise programs. So how do you address the exercise program component?
Excellent. Now, this is where this video conferencing makes a huge impact, because we can demonstrate the exercises here and we can see them doing on the other side. And if there is going to be any mistakes or, some subtle changes that we have to do, we can instruct them and we can adjust them, to kind of make sure that they are doing the right technique for the exercises. And the second thing is we do have platforms now from where we can actually print out exercise into a document, and we can email it to them. Yeah. And even better is there are links that we can send for that exact specific exercise that we are teaching our clients or our patients, that there will be videos that they can actually see and practice. And of course, in the subsequent follow-up appointments, we may want to modify them based on how they are coming along. So yes, we are going to demonstrate via the video conference, and we are going to email them basically the exercise sheets and video links that they can follow. Is there anything you want to add, Ansul?
I think another good thing about telehealth, again, I'm picking the positives here. You can see their home environment and have a talk about safe way to do exercise within their home environment. For example, a balance exercise, you can find out which is the most sturdy part of their house where they can hold on to a banister or some sort of a furniture. So there are a lot of good things about teaching exercises when they are home, because when you teach them exercise in the clinic, ultimately they do it at home. So
that's a really good point. So you had mentioned in the earlier part of the program that telehealth or telerehabilitation has been used for a while now. We're just, using it more because of COVID-19. How do we know that it's as effective? How would you comment to that?
There has been studies, and the studies, there are two very specific points mentioned. 90% accuracy in diagnosis between in-person versus telehealth diagnosis, and 80% satisfaction in treatment. So the statistics is pretty high. So the proof is in the pudding.
Yes. In other words, someone could actually go through a whole course of treatment and never actually step foot in a clinic and get the outcomes that you would hope. Yeah.
Absolutely. Before all this COVID-19 started, the College of Physiotherapy did recommend telehealth primarily to those who don't have access to an inpatient physio clinic. By any means, I'm not saying telehealth is the exact same thing as an in-person experience. No. However, as Ansul pointed out, since we have a 90% correlation in diagnosis and 80% satisfaction rate, it is not just as perfect as an in-person appointment, but still there is a lot of value that you can receive as a patient and we can provide as a therapist, just to make sure that you're on the path to your recovery.
Do I need a doctor's referral to be able to access the service, the telehealth?
The first thing is we physiotherapists are primary providers, so we don't need a doctor's referral as such to provide physiotherapy or for you as a patient to receive physiotherapy. However, some insurance companies requires a doctor's referral in order to get in order to reimburse the expense that you incur for physio. So you may just want to check with your insurance company on that prerogative alone if you need a doctor's referral. But if you know that you don't need a doctor's referral for insurance reimbursement, you can contact any of the physiotherapists in the area, and we will be more than happy to provide you physio. Did I get that right, Ansul?
Yeah, that's pretty much it.
So I'm wondering as well if you could comment, as we all hope COVID-19 stabilizes and we're able to bring it under control, is this a treatment program, telehealth, is that something that you will consider keeping going? And what surprises were there for you in using telehealth?
So I personally would definitely continue with, as long as the College of Physiotherapists continues to give us the permission to do it, because the few things I know, I have patients who have traveled from really far for lymphedema, to get measured, to get the ADP authorization paperwork, people for pelvic health. They live in Lion's Head and they have to come in for consultation. There's so many wonderful things that have come out of telehealth, and if there is regulations allow us, we would want to continue to keep that as one more set of services we provide. And when it comes to surprises, I was personally very surprised how much I could deliver. Because, of course, we being heavily hands-on therapists, our sessions, when we have our sessions are 80%, 75%, 80% hands-on. We were very surprised how much we could deliver in terms of tele rehab. So, yes, it's good.
Just want to add a little bit to that. Sorry, Carol. We live in snow and sound.
Yes, exactly. Very good. And that's
definitely, there is a lot of weather-related times when people are not able to travel physically to the clinic as such. Yeah. And as Ansul mentioned, there are people who live really far away, like Tobermory and Lion's Head, where people find it extremely difficult. So we can kind of have a half and half, where we have some sessions here in the clinic and some progressions and stuff like that we can do in their home, from the comforts of their home. Yeah. And as Ansul rightly pointed out, she does have some specialty experience. And so those sort of services are not available everywhere.
I can't believe our half hour is up. I want to thank you both for being on the program today. And I want to thank you, our viewing audience, for joining us. Please stay safe, stay healthy, and take care of each other. Thank you.